Are you chronically tired? It could be related to cytomegalovirus. On this episode, I talk to you what cytomegalovirus is and how it could actually decrease your energy production.
You're watching the Dr. Jake podcast.
I'm Dr. Jake. I'm an naturopathic medical doctor and integrative physician in Salt Lake City, Utah. On this channel, I share with you how you can heal your body without any harmful drugs and get your energy back. Be sure to subscribe for more videos like this one. I recently filmed a podcast with my co-host, Teresa Marie, in which we talked about cytomegalovirus and how it could be related to your chronic fatigue. Stick around to the end because we're going to talk about specific treatments that you can do to heal from this horrible virus. So cytomegalovirus is a form of a virus, and you catch it through coughing, through saliva. So it is one of our viruses that causes mono. So sharing a drink with someone, kissing someone, etc., through saliva. Also, you can just cough and touch a surface, or you can lick your lips and touch a surface, and then someone else touches that surface, you could catch it there. So obviously it's extremely easy to catch. And if you're around someone that has it, it's pretty contagious. It's not one of our most contagious viruses, but it's pretty easy to be able to catch this virus when someone has it.
So when somebody first catches it, what might they feel? Is it going to feel like, oh my gosh, I've got this crazy evil virus? Or is it going to feel like a cold? What are their symptoms going to be?
So when you catch it, it's not going to feel like a cold. I mean, some people aren't going to have as severe symptoms as others, but most people, when you catch cytomegalovirus, you are extremely tired. Okay, when you catch a cold or other bugs, you do feel tired, but this is a very tired sensation. It's like you can't really do activities very well. You're extremely tired. You're even way tired just going up the stairs. You're mentally fatigued. You just feel like you're going to take a nap all the time. You also many times are going to have a sore throat. You're going to have some abdominal pain. You're going to have fever, chills, body aches, and you will get a headache. These are some of the common things. Sometimes if you go to a doctor, they're going to order some blood work. They might see some elevated liver enzymes because it will cause inflammation of the liver in your body. So that's cytomegalovirus when you get it acutely. And then your body will eliminate that most of the time, not all the time. You could have the issue for a long time, but usually it will go dormant. We don't totally eliminate viruses from our body. It forms what we call a virome, which is just a dormant state of this virus.
So how long do these acute symptoms typically last?
Yeah, so these can last from 1 week up to several months.
Okay. Now, if it's several months, is that considered chronic, or is that actually just still the acute?
That's still the acute. Yeah.
Okay.
But let's say you get exposed and you've never felt better again. You're in the chronic state and it's been causing you problems for a long time. So, but that's not acute. But acute is like 1 week to 2 or 3 months, you could be experiencing issues.
You know, it does actually remind me of the virus that we've been talking about the last couple of years. Body aches, sore throat, fatigue. I know for me, I ended up even kind of feeling the long-term effects of just fatigue, just even a couple of weeks after getting rid of some of the other symptoms. And I know there's people out there who have had those symptoms and then got tested and were like, hey, I tested negative for it, so I must have the flu, or I must have something else. That something else could then, it sounds like it could very well be CMV.
Could be.
Now we're talking about people who today, they got sick, they never felt better. That could be somebody who's dealing with chronic CMV. Yeah. Could it also be someone who got it, felt better, then sometime later in the future, months, years, all of a sudden started feeling tired again? That's the way that they got it back, or it became chronic? Tell us about that.
So what can happen with many viruses, and especially these bad bugs like cytomegalovirus, it will go dormant and then it can reactivate itself. So what means it comes back, and it comes back with a vengeance sometimes. And the chronic symptoms that you will experience will be the fatigue. It will be a debilitating fatigue, even though everyone with chronic CMV doesn't experience this, but it's very common. Many times it will cause chronic inflammatory states. So you're going to have muscle pains, you're going to have muscle aches. Many times it will affect our brain. So we're going to have brain fog. We might even have anxiety, depression from this, sleeping issues because of that. It can cause neuropathies. You could get numbness and tingling and nerve pains throughout your body. And then you could maybe get diarrhea or constipation from it. It can maybe affect your endocrine organs like our thyroid or adrenal glands. Maybe it could decrease your testosterone production. So it's going to affect your entire body when it reactivates itself. And it will lead to so many different symptoms. And so some people listening to this might be like, man, that fits me to a T, or I've been dealing with all these different issues. And a lot of these chronic bugs cause similar type of symptoms. And it's just about finding out what bug it specifically is so you can treat it effectively.
For somebody who is feeling this fatigue and they're listening to you and they're thinking, okay, maybe that's what's going on. How did it reactivate in the first place?
Yeah. So how it works is usually, this is when I see it the most in my patients, is they have a traumatic event, a stressful emotional event, and then they start feeling really sick afterwards. It could be a couple months afterwards, but they just didn't feel the same after that. That could have been the reactivation of it. You could get a reactivation if you get exposed to another certain bug, another bad bug can reactivate the cytomegalovirus. You could take an immunosuppressive medication like prednisone or Humira. A lot of my patients with autoimmune conditions have all these bugs. Now, was it because of the suppressive immune system, or was it the bug in the first place that caused the autoimmune condition? Hard to say, but taking immunosuppressive medications will decrease your immune system. It's not able to keep the cytomegalovirus at bay anymore, and then it reactivates and it causes problems throughout the body. So those are the main ones that I see cause the reactivation.
For those people who think, okay, this makes a lot of sense. This traumatic event happened. I started feeling really tired after that. I haven't felt the same next. And they want to come in and they want to get, tested to see. And you test them and you discover, yes, you have an active form of cytomegalovirus. How do you help them get rid of it?
So what we do to get rid of it is we do a lot. So it's not about just killing the bug. It's about actually fixing the damage that has happened from cytomegalovirus. And I order a lot of blood work and also ask a lot of questions to really identify what type of trauma has happened to the body. So let's say some trauma happened to the thyroid, we might give you some thyroid prescription or work on helping your thyroid work more effectively. If it affected your adrenal glands, we work on that. If it's affected the gut lining, we're going to be working on that. We're going to maybe check a comprehensive digestive stool analysis, or we're going to do a food allergy panel and really find out if there's some trauma going on with that. And then we're going to work on healing the mitochondria. So a big way that cytomegalovirus decreases your energy production is it damages the mitochondria and your body's not able to actually make good energy production anymore. So what we need to work on is healing that up. And we do that with like carnitine or alpha-lipoic acid or glutathione or CoQ10. These are some of my major mitochondrial supplements. Also, I really love NAD. That can be really beneficial in helping heal the mitochondria. So that's just a tidbit of what we do just to heal the body that maybe was damaged by the cytomegalovirus. And then we go after actually putting it back into remission again. And we do that with some basic things like just taking oral vitamin C, high doses of that, high doses of zinc, taking the good amount of vitamin D, and taking high doses of vitamin A. All this needs to be prescribed appropriately by a doctor that knows what they're doing, because high doses of vitamin A could cause a problem, high doses of vitamin D could cause a problem, and high doses of zinc. So you just make sure you go to a doctor that knows what they're doing and monitoring things appropriately. And then we also are going to do something like monolaurin is really great for this. And then I'd like to do procedures in my office to really get this at bay. Sometimes you could just do the supplemental stuff, the dietary things, but in many instances, we need to be a little bit more aggressive. And we do some IV procedures. Some of them are high dose IV vitamin C, which is going to be 1,000 times more potent than just taking oral vitamin C. Many times I do IV artemisinin. I do take that oral many times for patients like this too. I also do hyperbaric oxygen therapy. This is going to boost your immune system to be able to get the virus at bay again. It also is going to heal the mitochondria and decrease inflammation and do all kinds of things throughout the body. And then last thing I do is it's a twofold thing. It's ozone. And I like to always combine that with something called photodynamic therapy, which is like an intravenous low-level laser light. Might sound crazy to everyone, Star Trek, but it's a highly effective treatment. And it also kills the bugs and also really good on healing up the mitochondria.
So it sounds like a couple of things are happening here when you're treating it. So I want to just kind of clarify a lot of what you talked about. There's first dealing with the damage that the virus has placed on the body, because if the body is damaged, you've got adrenals that are messed up and your thyroid's messed up and all of this is messed up, your immune system's already is going to be freaking out because the body's not doing well. And so everything's just hyperware. You're not going to be able to help, calm anything else down. And by first starting with like, let's deal with these symptoms. Let's get those calmed down and the damage. Then actually going in, and it seems like a lot of what you talked about, the vitamin C, the glutathione, like all of this other work that you do, the IV treatments and so forth, is actually strengthening the immune system, which should have kept the virus at bay in the first place. Something happened to the immune system so that it couldn't keep the virus at bay. So we have to now strengthen that immune system so that, in a sense, the immune system itself is what actually gets rid of the virus. And then you mentioned a third component, and that was this monolaurin, which I believe is a type of antiviral. It actually breaks down, I believe, the outer shell of the virus itself. Mm-hmm. So it's that part is outside of the immune system. It's a separate component that actually works specifically on the virus itself. Yes?
Yep, you're correct.
Okay. And you've talked about this on other episodes, using things like ozone and so forth it's a way of really another form of being an antiviral and antimicrobial way of actually killing the virus itself. So you're really hitting this in a number of different directions, which might sound like a lot, but for somebody who's dealing with a chronic virus that has, wreaked havoc on their body, like you really do need to approach it with a strong force like this, because you're here in the first place because your body couldn't handle it. Your body couldn't do it on its own. As far as maintenance goes, or even just how they might feel after this type of treatment, how quickly do you happen to see people start feeling better, feeling like they got their energy back, feeling like they're on a healing path from treatments like this?
I do have many patients that feel better quite quickly within like a week or two, but to get fully better, it usually takes 2 or 3 months, maybe even longer, to totally get this under control and get this virus all taken care of, and then heal all the damage that has happened from the bug. So it's going to take several months to actually get feeling all good. If you want to learn more about cytomegalovirus or other topics like this one, click my video to the right. I'm Dr. Jake, and I'll see you there.